Indiana's COVID-19 numbers continue to climb at a sharp pace. We're going to hear from the governor coming up as he forms a new state health commission this week. We'll talk about that with our panel coming up. But today we're also talking about the situation in Afghanistan. Indiana's elected officials reacting to the rapidly deteriorating situation throughout the week the White House and military has tried to deal with as the Taliban quickly takes control. Good morning, I'm Dan Spieler. It's a story many Hoosiers have been following closely, with some having to evacuate Afghanistan in the midst of the chaos. Our elected officials also keeping a close eye on the situation. We spoke with several of our congressional representatives this past week.
We had a situation where we had it stable and we had a sufficient number of troops to maintain that stability. And now we've turned that into chaos.
At this point, we just have to do our best, evacuating American people, American citizens, also the people who are our allies, how we can do that and see if we still can, get some resources out.
Let's just focus and let the military focus on the mission at hand, and that's to get people home. The execution has not worked, and that's it. I don't think anybody thinks differently on that.
All right, from the other side of the aisle, Congressman Andre Carson said the deteriorating situation is a tragedy. The U.S. government must continue to do everything in its power to get American citizens out of harm's way. He says we should also expand the visa program for Afghans who've aided U.S. troops. And he says he'll continue his efforts on the House Intelligence Committee to get answers, saying, quote, America cannot remain in Afghanistan forever, but we also can't turn our backs on the people who rely on us for security and guidance. Meantime, Congressman Jim Banks, a veteran, saying, I'll never forget the men and women I served alongside of in Afghanistan. Our president must assure them our nation will never forget their sacrifices and those of their families. Congressman Banks has been very critical of the president in recent days. This week, I spoke about the crisis in Afghanistan with Indiana Senator Mike Braun. I'm here now with Senator Mike Braun. Senator, thank you so much for spending some time with us this week.
Hey, my pleasure.
A lot to talk about, obviously, in Afghanistan, and there's certainly been a lot of blame to go around when it comes to the situation there and reasons to be critical of the current or former administrations and prior administrations. But what's the solution right now? What can be done differently, in your view, to help the people of Afghanistan and to help the Americans who are still trying to get home?
And I think it's important, Dan, to actually look at that, because it is clear. I've never seen a lambasting like this from the full spectrum politically, and even as harsh on the liberal side as what you'd normally expect from the other point of view. We botched it in the sense that we had all the material there that we should have brought back into the center, along with our people safely, and the Afghanis who are really in peril that may have helped us along the way. And at least it was such a chaotic first kind of sequence of it. They're acknowledging the problem, and we're still going to be handicapped because we gave up a lot of what could have been. And that was keeping a hard perimeter from these outward air bases and to where we had stations, and bring everything back into the center. And we're just, I guess, kind of lucky that the Taliban did stick with what they had kind of agreed to with Trump, that they're not going to hit us as we're going out. A lot of it just seems to be self-inflicted pandemonium, but I think it's still salvageable. I'm hoping that with everything we've learned within the chaos, that we take as long as it takes, with the ability to do it, to get the task accomplished in a way that gets it minimally all of our folks out, the Afghanis that helped us. It looks like we're going to maroon an arsenal that will be larger than most countries have. And that's sad as well, because it all could have been done in a logistical way where we were in a strong spot, even though everybody knew we needed to get out there. I agree with Trump originally and Biden. We cannot be in quagmires like Vietnam taught us first, Iraq did it again, and now here in Afghanistan.
Well, we did hear former President Trump, even in recent months, say it's time to get out of Afghanistan now, that we shouldn't waste more money or American lives here. So is there blame to go around? And again, when it comes to solutions, what else should we be considering at this point?
I think the blame game on something that is as critical as this, there definitely is egg on our face. And, I think along with the southern border, where again, the policies were working. You know, I and about 18 other senators were down there in March. And just because Trump did it, I think we should have kept that in place until you had a better plan B. And now this in Afghanistan politically, you know, I think if you end up turning this around and actually doing a good job with everything we've learned, despite how chaotic it's been this first week or so, we can get through it.
I also want to ask about the pandemic today. The federal government now clearing the way for a booster shot of the COVID-19 vaccine. I know you've shied away from discussing your own vaccination status, but we are seeing more and more companies now requiring vaccinations. Now this news about boosters. What's your message for Hoosiers about the need for these vaccines right now?
You know, from the beginning, I did floor speeches about how tricky this navigation was going to be, and it was a balance between our own health and the health of the economy, and that's played out. But in this case, I remember interviewing Fauci and Redfield about who was going to do the vaccine. It was a miracle we got it done, and I've been very straightforward. Get the vaccine. You have to have a good reason why not to, and including the booster. I don't think that it's probably going to be the end-all solution, in a sense that most of these variants have come from overseas. And we're going to have to contend with this maybe on an ongoing basis.
All right, part of my interview there with Senator Mike Braun. Meantime, as Indiana's numbers continue to climb, I spoke one-on-one this week with a member of the White House COVID response team, Dr. Cameron Webb.
This fight is certainly not over, even though we've got almost 200 million people who've had at least one dose of these vaccines. We still are seeing that there are a lot of cases, there are a lot of people in hospitals, and there are unfortunately still too many people dying from this pandemic. And so I think the idea here is to make sure we don't lose any of the progress that we've already gained. You know, folks who were vaccinated early on in this process, often some of the most vulnerable, highest risk individuals, whether they're healthcare workers or seniors, they're coming up on that 8-month window where the most recent data that we have is showing that, you know, that immune response may start to wane. And we don't want to wait until we see those people getting sick or being hospitalized. We wanted to make sure that we developed a plan before then. So today's announcement really just was the plan. And I think we're going to wait to see FDA make their formal recommendation. We're going to wait for the Advisory Committee on Immunization Practices to make their recommendation. But we wanted to have all the pieces in place. If they say we need to go forward with boosters, like some of the evidence is currently seeming to suggest, we want to make sure we're ready to fly and get those shots to folks to keep people protected.
The goal is September 20th, if all of those other things fall in line from the FDA on the authorization and that process. I want to talk about Indiana specifically here, Dr. Webb. We've been in the bottom half of states when it comes to vaccine hesitancy. Obviously has been a problem both in our rural and in some of our urban areas as well. How does the White House COVID response team meet the challenge of getting the first shot out to people, as we also talk about now these third shots for some Americans as well?
Yeah, you know, it's a bit like juggling. You know, this is another ball in the air, but yet we feel like we're in a pretty good rhythm with folks continuing to get vaccinated every day. And you look all over the country, over the last few weeks, we actually had an increase in the number of folks being vaccinated, I think, as they see the damage that this Delta variant can cause. And so certainly from the White House standpoint, we're continuing to push full speed ahead to make sure that we are, you know, getting vaccines into communities, but also continuing to message appropriately. But, you know, in Indiana, you've got a great messenger in former Surgeon General Jerome Adams, who's continuing to push and talk to folks about getting vaccinated. And we met with him just a couple of weeks back. And we continue to just try to work with anyone and everyone who can help spread the word about how important these really safe, really effective vaccines are.
All right, my interview there with Cameron Webb from the White House COVID response team. Also this week, Governor Holcomb forming a new state health commission to focus not only on COVID, but other health issues we may face in the future. Kristen Eskow has more.
The task ahead couldn't be more important, and the time of the work that's going to be conducted couldn't be more pressing.
Governor Eric Holcomb says the pandemic has revealed the strains on Indiana's public health system and acknowledges changes are long overdue. That's why he's created a commission of 15 people led by a former state senator and former health commissioner. They will conduct listening tours around the state and identify shortcomings and potential solutions for Indiana's 94 health departments.
We have some larger departments that have hundreds of staff members, while smaller counties may be lucky to have 3 to 6 full-time members, and sometimes many of those are part-time.
State Health Commissioner Dr. Christina Box says the goal is to improve access to public health services. She says the commission will examine funding, the public health workforce, and services for children. It will also review the state's COVID-19 response.
We'll be looking back at the past pandemic and how we might be able to improve even our response going forward to a public health emergency.
Dr. Box says the commission will meet monthly starting in September and issue a report with recommendations late next summer. Then Holcomb will work with the state legislature and others to implement those changes.
And our hope and what will drive us is this is going to lead to a better system over the next 100 years.
Governor Holcomb says this commission will not serve in any advisory role regarding the immediate response to the COVID-19 pandemic and will instead remain focused on long-term solutions. From the Indiana State House, I'm Kristen Escow.
Kristen, thanks. Coming up, we'll talk with our panel about the pandemic, the situation in Afghanistan, and the battle over redistricting at the State House, with new census data laying the groundwork for that debate that lies ahead.